I'm going to hit record right now. And with that, I'm going to go ahead and turn it over to Christine Nadolski with our professional insurance programs.
Hi, welcome. Thank you for attending our very first town hall meeting. Today we'll learn why the health association or the association health could answer some of your employee benefits. It gives you flexibility, it gives a customization, which is definitely key in small businesses, medium businesses, and large businesses. We'll learn the ins and outs of the association health plan and answer, like Annette said, any questions that will help make a better choice for your firm. So let's start by debunking some of the most commonly frequently asked questions that we kind of came across. So let's get started and dive right in. Oh, okay, now it's not working. There we go. Do I have to wait until the beginning of the year to establish a group plan? Now, normally with individual health plan, we have an individual health enrollment, annual enrollment period, which ends December 15th. With group plans, we're actually able to establish a group plan at any point in time throughout the year. So it's a big misconception a lot of times when people say, well, I've already renewed my plan for this year, and you know, I think that, you know, we should wait until next year. No, not necessarily. Come to us, give us the census. We'll certainly be able to quote you out at any particular point throughout the year. So if you're feeling challenged by your current group or want to investigate some additional options, feel free to contact us. We'll be more than happy to look at those group plans anytime. Next question, a lot of people say, well, who's eligible for the plan? With normal Affordable Care Act plans, you have to have at least 30 hours to be considered full-time. Our association health plan we developed with WPS and courts, we were able to custom fit and really make our own plan, which we dropped those hours down to 26 hours. A lot of times we know that 30 hours in a small firm especially can be difficult for an employee to actually meet. So that 26 hours is actually considered full-time. Now, if your handbook says 30 hours or more, we'll certainly go by your handbook because we don't want to step on anybody's toes with the firms. But 26 hours definitely would be the required hours for benefits to be eligible. Another big concern with employees or employers is actually the contribution for employee premium. A lot of firms are very hesitant to say, well, I want to look at employee benefits, but I have to do 50% of that employee premium. With us, we recommend 50%. But employers have the ability to designate how much they want to contribute, if at all. So you can contribute 0% up to 100%, depending on what your financial stability is with your firm. This makes it very easy to custom fit plans for firms, and definitely makes it easier for to offer coverage, which is very valuable for employee benefits. Now, if all of the employees waive off the coverage except for one, can you still get coverage? Absolutely. We have the plan where you can have one employee enrolled and one employee waiving, or the rest of the employee waiving, only because maybe they have other health insurance through a spouse, through an individual plan. We can offer coverage for firms with one employee enrolling and the rest waiving. Now, the key thing to keep in mind also, if someone loses coverage, obviously they can be offered the coverage and come on to the plan the effective date they have lost coverage, the first of the month. The plan would need to be offered to any new enrollees. They would need to satisfy their probationary period first, and then they would be eligible for the plan. If somebody decides that they don't want the coverage and then later on during the year decides, oh, you know what, I really kind of want to get on that plan. I see people and they're benefiting from the networks and the additional information or value adds that they have. Anyone who actually declined coverage would have to wait until that group's open enrollment. So normally that's the month prior to the renewal date. So if they enrolled in a group for 1/1, that enrollment period for that group would be 12/1 to 12/31 for a 1/1 effective date for the following year. Let's see, what's the difference? Again, with our quotes, they are actually composite rating. So they have single, limited family, and full family rates. The single rate is obviously just one employee. The limited family would be an employee and a child or children or a spouse. And then a family is just that, 2 parental units and children or a child. And again, it doesn't matter if you have 1 child or if you have 10 children, it's still going to be a family rate. Composite rating is quite different than the Affordable Care Act age rating, where age rating on the Affordable Care Act will take a 26-year-old and a 52-year-old and actually rate them differently because of their age. Composite rating is straight across the board. So who really benefits from this is more the I want to say mature employee. The employees who are 30 and up will have the same rate as someone who is 20, 19, it doesn't matter. So it really kind of sets that pace for the group. Again, the more mature individuals certainly do benefit from that. They're not paying those thousands of dollars when you turn another age. Am I able to offer multiple plans with the State Bar Association health plan? As long as we have an employee in each one of the plans offered, we can elect up to 4 different plans within the group. So it really helps to customize. Say somebody wants a copay plan because maybe they have children and they run to the doctor a lot with the children, ear infections and what have you. Or somebody has just preventative care that they do. Maybe they would like more of a high deductible health plan because they know that all they go in for is their preventative services. The State Bar Association health plan allows you to elect, like I said, up to 4 different plans to custom fit these plans for your employees and for their medical usage. As long as we have an employee in each one, we're good. We can't have an open plan with nobody in it. What if the plan, let's see, for the employee's spouse has coverage that includes a spousal carve out rule. This is a very interesting rule. An employer that offers a self-funded plan may actually have this rule in place. And what this does, it says that if an employee's spouse has this type of coverage, then the employee must elect the coverage that is being offered through their employer. A lot of times, if the spouse has a spousal carve out, they'll get an extra fee added on to their premium if the spouse is on that plan and not electing her or his own coverage. So this is a kind of a roadblock that we run into a lot. We haven't run into it frequently this year. Last year it seemed like a big deal, but this year it really hasn't been an issue, which is a good thing. Our enrollment's underwritten because this is actually an association group and it's under large group rules. Everything will be underwritten to determine final rates. We actually will provide you with the preliminary rates. And the great thing is that from groups from 2 to 9 in size, Effective 1/1, WPS has actually reduced their rates by 12%. So this is very attractive pricing for those smaller groups, and it will be underwritten to determine, like I said, those final rates. Can a group be declined? Absolutely not. Large group association health, they cannot decline anybody for coverage. However, depending on the pre-existing medical conditions, an underwriter may impose a rate increase. When we get the final rates back from underwriting, we forward them to the group lead or the attorney, the owner, for their discretion, that they can look at it and say, well, you know what? Yep, this looks great. I'm going to sign away. We're going to enroll in the plan, or the rate increases were just too high. We're going to look for something else. And if that does happen, know that we do offer Affordable Care Act plans as well on a group basis. So you won't leave empty-handed when you come to us by any means. We want to make sure that we're taking care of our members. Why is the rate for a single person younger than the, or the same for a mature single person? Sorry, I read that incorrectly. Why is the rate for a single younger person the same as the mature single person? And I touched base on that a little bit with that composite rating. So instead of having that premium age rated, it's composite rated, which is in a lot of cases a very good situation for the groups. Is there network coverage out of state? Absolutely. The network that is utilized for WPS is a statewide network. WPS Health Plan, which was formerly Arise, is the Premier Network. Nope, it's not Premier. I'm sorry. Select Plus Network. That's why I have one here. I have the old information still. They both utilize out-of-network providers for South Dakota, North Dakota, and Minnesota. It is Preferred One. And then everywhere else in the United States, it's First Health. So you can rest assured, if you have dependents going to school out of state or out of your servicing area, they will have coverage with the availability of the networks from coast to coast. Even if you're traveling on business or pleasure, you will have coverage, most definitely, if you go to one of those networks. And that's a big plus, because individual plans will not have out-of-state coverage unless it's emergent. So, and it has to be coded as such in order to have that be covered as an in-network. Is preventative care covered 100% like the Affordable Care Act plans? Absolutely. If you go to an in-network provider, your services will be covered for preventative at 100%. Mammograms, pap smears, annual physicals, those will all be covered at 100% each year for you going in network. And how do you request a quote? You give us a call. You give us a call, you shoot us an email. The information is on the screen. We can turn around quotes for WPS and WPS health plans within 24 hours, if not sooner. So we're very good. We have the quoting material on our desktops. We're able to generate those quotes instantaneously for you, which is great. So you don't have to wait for any of that. So, and can you get this plan through another agency? Professional Insurance Programs is actually the exclusive agency for your association health plan. We are the ones who would be able to quote it, write it, and service it. So if you go to another agency and ask them for this, they're not going to know what you're talking about, for one. But they're like, no, we don't write that. We are the sole owners of that to write. So that's a great thing. So if you do have any additional questions, certainly, throw it in the chat and we'll answer them today. If we don't know the answer, we'll get back to you by all means. But we are here and we're happy to spend time answering questions for you. We're always available to renew your current policy as well. And we can be reached at the number on the screen or the email again. So, okay, so let me get out of this one.
So Chris, maybe we want to ask, there's a question in the chat that says, is Mayo Clinic included in the network?
Yes, it is. With the WPS, it is included in the network, definitely.
And if there are other questions and you'd rather unmute yourself and ask, feel free to do that now while Chris is pulling up the other PowerPoint slide for the presentation. And once she is ready to go, if you have questions, feel free to put them in the chat box. Is there any questions that anyone would like to ask Chris at this point?
Sorry if I missed this, but Chris, do you have plans for just one employee?
For one employee, you would have to have an additional full-time employee that would be waiving off. So we do not have it just for a sole firm. In that case, we would have to look at individual plans. Right now, though, that wouldn't work either. I was going to say, if you had another employee that's waived off, we could look. There's a special enrollment period for group plans on the ACA, but you would unfortunately have to have another employee on there, Mark. I apologize for that. But we can help you with individual on that.
Okay. All right. Thanks.
Thank you for your question. It's a very good question. Definitely. So are you ready to get into the nitty gritty of it?
Yep.
All right.
Why don't you head in there?
The State Bar Association or State Bar of Wisconsin Association Health Plan. It's a tongue twister. Most definitely, of course, again, my name is Christina Nadolski. My partner is Wendy Block. And we're here to tell you about the coverage, understanding your health insurance basics, common health insurance terms. I know a lot of times people get kind of mumble jumbled in all of the jargon that we have, because we have a tendency to talk and we talk like everybody knows it. And we apologize on that. And I'm sure it happens in your profession as well when you're speaking with people. Obviously, your premium is going to be your monthly payment that you have, like going to the gym or car insurance. You pay that premium, you have your protection. Your co-pays are actually a predetermined rate that you pay for your health insurance at the service at the time of care. So for instance, we have 5 copay plans that have a $25 copay for primary care and a $50 copay for specialist care. Also with medication. So you have your different levels of your copays for medication, for generic, brand name, preferred brand name. Your deductible is actually how much you're going to pay before your health insurance actually starts to cover a larger portion of your bills. In general, if you have a $2,500 deductible, you have to pay $2,500 out of your own pocket before the insurance starts kicking in a higher portion for those costs. Deductibles always start over January 1st, regardless of when you actually enroll in the group. So if you enroll in a group plan, say in June, your renewal date is going to be June 1st of every year, but your deductible is going to roll over January 1st. So sometimes it's a little confusing, and I know a lot of times people like to have a January 1st renewal date, January 1st deductible start over date. And I think that's why we're so busy in a lot of times with the fourth quarter, because it's easy to coincide those two together. Your co-insurance is actually a percentage of your medical charge that you pay, and then the rest is paid by your health insurance. Typically applies after your deductible has been met, say like for lab services. We have a 20% plan. You pay 20% of your lab fees, and then WPS actually pays 80%. So it's kind of a cost sharing, kind of keeping the cost down for your premium as well. Your out-of-pocket maximum is actually the most that you would pay in a calendar year out of pocket for your health insurance before the bill or the carrier picks in 100% of your bill. So if you have a $2,500 deductible at 100%, you've gone in for a surgery, it's $2,500 you pay. Thereafter, you're done for the year. So you're going to be covered at 100% thereafter, which is a really nice thing. We have the different types of networks. Networks are actually a group of doctors and hospitals that are negotiated for lower prices for doctors, care clinics within the network. So if you go in network, your provider has agreed to work with the insurance plan and offer you services at a discounted rate. Now, if you go out of network, these are providers that have not negotiated those discounted rates. And if you get care from an out-of-network provider, you will be actually paying more. Sometimes the entire bill yourself or just a portion. It depends on how your insurance policy or how the plan is. Types of different plans. There's two different plans that we offer with the Association Health. There's a copay plan, and we have 5 of those that has the predetermined rate, as I spoke about before, for your health insurance. They normally have a tendency to have a higher rate for premium because they have first dollar benefits that are included. So your copays, for your doctor office visit, your specialty visit, emergency rooms, and your prescriptions. The high deductible health plans are actually just that. They have a higher deductible, and everything actually goes to the deductible and the co-insurance prior to the plan paying for services. So people who like to save a little bit of money, who don't doctor as frequently, or like to have a separate health savings account set up with the high deductible health plan, can do so if they elect this type of plan. Again, keep in mind that your preventative services are actually going to be paid at 100% when you go in network. So this is a way of trying to keep premiums more cost efficient, but still having a nice rich plan. You're just not going to have those upfront dollars that are going to pay at first. And then this is actually how you and your insurer share costs. This is an example. This Jane, she hasn't reached her $1,500 deductible yet. Her plan doesn't pay any of the costs. Her office visits cost $125. She pays $125. Her plan pays nothing. She actually has a $1,500 deductible with 20% co-insurance and a max out of pocket of $5,000. So once Jane, excuse me, I'm calling her a different name, reaches her $1,500 deductible, the co-insurance then begins. So she has seen a doctor several times. She's paid $1,500 in total. Her plan does pay some of the cost for her next visit. So her office visit was $75. She pays 20% of that $75 or $15, and her plan pays 80%. So that's where that co-insurance kind of kicks in. Once you've reached your deductible, that co-insurance will kick in for some services. Now Jane actually reaches her max out of pocket of $5,000 on this next example. Jane has seen the doctor often. She's paid $5,000 in total. When her plan actually then pays the full cost of her covered health care services for the rest of the year. So she has a $200 office visit, say she has some other types of visits, she doesn't pay a thing. Her plan actually pays for all of the services. And this is a good example of like a high deductible health plan. Not such a high deductible, but most definitely one of those types of plans. Now with the State Bar of Wisconsin, like I said, we have copay plans and we have high deductible health plans. Here are the plan designs. So your copay plans start at a $750 deductible with 20% coinsurance. We have various plans that go up to a $5,000 deductible, 20% coinsurance. Obviously, the higher you go with a deductible, the lower your premium will be. Your HSA qualified or health savings account qualified plans that allows you to set up a side account are listed here as high deductible health plans. Starting at a $2,500 deductible, 0% coinsurance, and then ranging to a $6,550 deductible with 0% coinsurance. Now there's asterisks by the $2,500 deductible options because those are non-embedded deductibles. And it's very important to know the difference between embedded and non-embedded. If an employee has a family coverage and the family deductible must be met before the plan pays any benefits. So when we're looking at the higher deductibles, the $5,000 and $6,550, those are non-embedded non-embedded deductibles? Embedded, sorry, those are embedded deductibles. When the family member meets his or her own deductible, the insurance begins to pay the plan coverage for that member. So Jack went in, he's got a family of 3. He had $5,000 worth of services rendered from an accident that he had. His deductible and coinsurance, because it's a 0% coinsurance, his deductible has already been satisfied. So the plan will actually pay for all of his services. Now, Jack's wife and the rest of the family have their own separate deductible of $5,000. So all of their expenses combined will help to go toward that $5,000 deductible.
Chris, I'm gonna interrupt for a second. We did have a question in the chat that said,
Absolutely.
are those deductibles family or single deductibles? So
And
I just wanted to mention that since you're on that topic.
No problem. And that's a very good question. These are actually individual deductibles. So when we have a family, it would be 2 times the individual deductible. Very good question. Thank you. So a non-embedded deductible or aggregate deductible is a lot simpler to understand. Everybody's medical expenses are put in the pot, and once they reach that family deductible, if it's a family unit, then their expenses are paid at 100%, or according to the co-insurance. So little difference right there. So and it's key to know that you'll have the higher deductible, you'll have that one big pot, and the lower the deductible, you'll have your individual deductible, and then your family will have their own deductible as well. All right, benefits of the plan. Again, you can select up to 4 different options within a carrier. This gives you and your employees flexibility when selecting a plan for themselves or their families, depending on what their medical needs are. Employer contributions can be set by the employer from 0 to 100%. This gives the employer some more freedom when electing. And although we do suggest 50% of the single premium, it is not regulated. You can contribute what you need. Full-time employees, again, covered at 26 hours, they're eligible for the coverage. Again, I always want to say, if your employee handbook says something different and it's 30, then we go with a 30. It's, we always want to abide by the firm. Customer resources is convenient access to online tools and resources for your best health. You have access to health and wellness information. When you become a member with WPS, you can log on to their member portal. They have just about an encyclopedia of information for you. You could probably self-diagnose yourself, almost like a WebMD. But they do have, okay, if this symptom is this, what would be, the relative order that might be. It really is a complex website with tons of information that's available for you. And then also the convenient mail-in prescriptions. I find this to be one of the priceless items that WPS has, because I don't have to run to a pharmacy every month to go get my prescriptions. Express Scripts sends me an email. I click onto it, I look at it, I click, okay, refill, refill, refill. They have my payment information online. A week later, my pills are in the mail and everybody's happy. So, and my mailman normally, tucks them away so they're not seen by any means. There is a prescription drug copay on select preventative drugs that we do have in the office here, and we can certainly send that as well to anybody who would like to see that. But most of the common drugs for preventative could be covered at a $0 benefit, so you'd get them for nothing. Preventative care, again, routine immunizations, medical exams, well baby, mammograms, preventative screening, preventative drugs, covered at 100% if you're going with a preferred provider. There are a lot of value adds as well. Dental insurance, we can add dental insurance, but I know that the association does work with another carrier, so that's fine. Fitness reimbursement, we do have that. That encourages employees to stay active as we can be in a COVID situation. It's a lot of gym home workouts instead of going to the gym these days. But it does include a large fitness chain, independently owned clubs, the YMCA, YWCA. And then you're able to receive a $30 reward each month for visiting a health club or fitness club 10 times or more in that month. Now, I don't recommend that in the COVID situation, but if you do it where you're doing it safely, then by all means, please feel free to, to get that $30 reward. There are discounts for fitness centers as well, and they have actually over 9,000 participating fitness centers, so nationwide. So anywhere you go, you're able to work out and stay fit. And being at home, I know a lot of times we get tied up, maybe we have a loved one who's sick or a child who's home. Telemedicine is of value these days. It not only covers you for mental health, which is a huge situation nowadays with being isolated and being remote and not connecting with others. WPS uses Teledoc. We also offer quartz for the Dane County area, and they actually have a UW Healthcare Anywhere. This is a portable app. You don't even have to get out of your pajamas if you don't want to. You give them a call, they'll call you back. You can video chat on your phone, your computer, or just talk to the doctor. Get help where you need it. They can actually prescribe normal medications, nothing narcotic by any means, but antibiotics, anything that you could possibly get over the counter or through the pharmacy. And it's 24/7, 365. So you can contact them if you're on vacation. You can contact them in the middle of the night if you're having an anxiety attack or you feel like you just can't handle. If your child is sick, it's an invaluable resource that we have with them. And that's it. I want to thank you. Are there any other questions that anybody may have?
Chris, we did have another question in our chat box. It says, do the firm contributions have to be based on a percentage, or can the firm cover a specific dollar amount and the employee cover the rest?
We have a lot of clients who actually do either or. They say, okay, I'm going to contribute 25%, 50%, or we have clients who say, well, I give them a stipend of $200 a month for coverage. Most definitely. And if we are going to be deducting money out of someone's payroll for premium, because the bill will come actually in the firm's name, and then it's up to the firm to get that money from the employee. What we actually like are the premium only plans, which allow an employer to actually deduct on a pre-tax basis the premiums for their health insurance. In the long run, actually, the employer saves money, the employee saves money, which is kind of nice. So we have a couple different distributors or third-party administrators that we work with, one being Task, and then we also work with Diversified Benefit Services. Sorry, I always call it DBS, so I apologize. And both of them offer the premium only plan that will allow an employer to deduct pre-tax dollars. Otherwise, it will have to be post-tax. So there's a little bit of income tax that you do save when you're doing it pre-tax.
Okay, and we are getting some more questions. Great questions from our group here today. We have the question asking whether you could walk through the underwriting process and whether there are physical exams required. All employees are just those who participate.
Oh, that's a good question too. Not a problem. When we are looking at trying to get final rates, what we do is we run our preliminary quotes. We send those over to the firm along with an employee application. Now that is basically your underwriting. So you complete the application, fill out any of the medical information, list any conditions, any medications or treatments that you are currently on or plan on having, and surgeries that you might be planning on having. And then once we get the employee applications and the quarterly wage and tax back from the employer, we forward that over to underwriting. There are no physicals at all. So you don't have to be put out and take time out of your day to do that. It's just basically the employee application that the underwriter is looking at. They will go ahead and the underwriting department will review all of that information, make their final determination, and then forward us the final rates. At that point, we actually will forward those onto the firm along with an employer application. And really, that's about it. Once we get everything back, and oh yes, thank you. Wendy just brought up a point too, that people who are waiving off of the coverage, they do not have to go through underwriting. So they just sign that they're waiving off of the coverage and the reason why, and then we take it from there. So it's just the employees who are actually enrolling that will be underwritten.
Okay, and if anyone who asks these questions has a follow-up, feel free to either let me know, you can ask a follow-up question without any issue. The next question in our chat box is the Aurora system in network? And Children's Hospital was also asked about. And is there a network directory available online?
Yes, yes, and yes. Aurora is one of the big provider networks. Actually, with WPS, we have Aurora, we have Bellin, we have UW system, we have Mayo, we have Purveya. So all of the Freighter, Children's, so all of the large and a lot of the little speckled providers are within WPS. We want to say about 98% saturation of provider is in WPS. There is a provider network that you can utilize online. If you go to WPSIC.com, there should be a spot where you can find a provider, and you would want to go in as a guest. And then you can, from there, put your zip code in, your county in, and search either facilities or search specific doctors' names as well. So, very good question.
All right, and this person wants to just verify, you said WPSIC.com to have access to that provider network going
Correct.
in under guest. Okay, so that is a yes. There's another question in our chat box asking if there are diabetic limitations on insulin and or diabetic supplies.
Do you know that one, Wendy?
I do not, I'm not aware of any limitations.
Okay.
I can express that an insulin pump is going to be subject to your deductible and co-insurance.
Do you hear that?
I can
You need to
verify
repeat the
that.
answer.
Oh, okay. Come on over, Wendy, just
Oh, okay, I'll come on over.
come on over.
Hello, in regards to diabetic limitations, none that I am aware of. An insulin pump, for example, is considered durable medical equipment. So durable medical equipment is always subject to your deductible and then your co-insurance. However, for things like your test strips, your lancets, those would be under the prescribed medications, your prescription drug copays. Oftentimes, they're actually part of the preventive drug list and are at no cost to you. When it comes to your insulin, that is it's going to depend on the type of insulin and what the copay would be.
Yes. Thank you.
You're welcome.
All
And I
right.
do see that on the $0 copay list. There's non-insulin oral agents, insulins, injectables that are listed with the various names as well. So we can get that over to you, Annette, if you would like, just for reference, if anybody else does have any questions on that.
Okay, and I wanted to just ask if there were any other questions. We have enough time. If anyone has a question and wants to come unmute and ask that question, please feel free to do so. While people may be thinking of questions, Chris, I'm wondering, did I see somewhere that this policy has also done some real positive things in connection with increasing their coverage on mental health, related to mental health?
Yes, with the teledoc, I know that there has been $0 for or first dollar benefit for mental health. A lot of, and I can double check on some of the medications as well. Respiratory diabetes, I'm just looking here to see.
Well, they do have to follow the Mental Health Parity Act. We have to,
Okay.
under mental health. So that means that mental health is going to be covered the same as any other illness.
Okay. Did you?
And what I was referring to was the fact that they expanded preventative drugs at no cost sharing that were in response or being prescribed as a result of mental health issues. And I think that was an additional coverage that was added to this program this year.
Okay.
And that's what I was referring to. We do have another question in our chat box. Prescription plan is through Optum, and she thought she heard you say that. She just wanted to confirm where the prescription plan was coming from.
No problem. That's a very good question. Actually, the prescription is through Express Scripts. So they have home delivery available. If you go retail, I believe when I signed up, I had to actually opt out of the home delivery. So when I went to go get a prescription at the retail, then I was able to. So, but I actually have the home delivery. My husband was having an issue with it. And I said, honey, you have to opt out of the home delivery if you want to get it retail. He's like, well, okay. And I'm like, it's just easier to get it retail a lot of, or home delivery a lot of times, especially if you're in the office running around and you don't have, like, okay, now I got to run to the pharmacy. But it is through Express Scripts.
Okay. Are there any other questions that anyone on the call has that hasn't been covered or something that came to you? It looks like it says any large pharmacies not in network for same day scripts. So are there any large pharmacies?
Not that we're aware of. Most of the major pharmacies are in network. Where we run into some issues might be the mom and pops. But most of the large pharmacies, Walmart, Walgreens, Myers, Target, Sam's Club, a lot of those are in network.
Okay. All right.
Very good questions. Thank you.
Yeah, no, some great questions from the group today.
Oh, absolutely.
And one last call. Are there any other questions you may have thought of? I didn't introduce myself at the beginning, so I just want to let you know my name is Annette Ashley. I am with the State Bar. I just wanted to put my name out there because if there are other questions you have and you want to get in touch with me for some reason, or for questions or for other benefits that we may offer members, feel free. I'm going to give you my email address just so it's right close in front of you. It's aashley@wisbar.org. Feel free to reach out to me if for some reason you're having trouble finding contact information for Chris and her team. Feel free to reach out to me. I can provide that to you. There is another question that said from someone that missed the first few minutes of the presentation. They're wondering if they might be able to have access to the slides. Would you be okay with us sending the slides out to the folks on the call? Okay.
Absolutely.
And I have the slides, and
Perfect.
And I know how to find all of you. So I will go ahead and send that out to everyone on the call, just so that you have that for additional information.
Wonderful. Thank you.
All right. Well, if there are no other questions, again, I want to thank you for joining us today. Feel free to contact us with more questions. Chris can help you with the direct information on premium quotes and answer more of those detailed questions about coverage and the plan and those types of things. Feel free to reach out to her. And I hope you have a great rest of the day. And thank you for joining us. Chris,
thank you, everybody.
Did a great job, Chris and Wendy. I really appreciate your time. And thank you so much for helping us out with this.
Thank you, everybody, for taking the time out of your day. We appreciate it. Have a fantastic day.
All right. Take care.
Bye.
Bye, Chris.